There are disturbing signs this morning that a deadly disease may be spreading from Florida to other parts of the country. A MERS patient in Orlando appears to have infected at least 2 other people, and health officials are tracking others in the United States and Canada who may have been exposed.
The original patient waited in a busy emergency room for 4 hours, and it took another 8 hours before doctors moved him into isolation. Dr. Holly Phillips says this case is now a priority at the Centers for Disease Control. Holly, this is serious. Good morning.
Very much so. Good morning, Nora and Charlie. The CDC is now trying to track down around 100 people who may have overlapped with the infected patient at 2 Florida hospitals. MERS, a respiratory infection similar to SARS, originated in the Middle East and has already killed an estimated 145 people worldwide. Now it's in the U.S., and health officials are taking it seriously.
At this hospital in Orlando, Florida, doctors say 2 healthcare workers who were exposed to MERS by a 44-year-old infected patient both have shown worrisome flu-like symptoms, and 1 has been hospitalized. As a precaution, another 20 healthcare workers have been sent home, where they're now being closely monitored.
All the emergency departments in the United States, to be perfectly honest, need to become very proficient with handling the Middle East respiratory syndrome virus.
The infected patient departed from Saudi Arabia on May 1st. He took 4 flights, from Jeddah to London, then to Boston, Atlanta, and finally Orlando. While traveling, he developed flu-like symptoms. A full week later, he was admitted to the hospital in Florida. The CDC has started posting these warnings at major airports, explaining the possible MERS risk to travelers.
It has a very high mortality rate. About 1/3 of the people who have acquired this infection have died of it.
This is the 2nd case of MERS on U.S. soil. Last week, a patient in Indiana was hospitalized with the virus, but has since been released. Concern of a possible outbreak has even reached the White House.
The president has been briefed on this development. The CDC is taking the current situation very seriously and is working in close coordination with local health authorities.
Officials say the Orlando patient is currently in good condition. Once contracted, it takes 5 days to 2 weeks to begin showing symptoms of MERS. There's currently no cure or vaccine for the virus. Charlie, Nora.
Thank you.
Thank you, Holly.